Thank you so much, Pamela. It's Wednesday, and that means it's time for Healthy Living. Today, Dr. Richard Reed joins us from Family Medicine of Terre Haute to talk about patient-centered medical home. First off, what is that?
Well, it's being proposed as a new idea. It's actually, I think, an old idea, but it's the idea that people need to have a family physician to help coordinate their medical care, coordinate it with specialists and other medical care providers. Studies have shown, studies by large corporations such as IBM, Microsoft, Johnson & Johnson, that if you do that, people get better medical care and the cost of that medical care is much lower.
So there's definitely some big benefits here.
The benefits are for the patient, nobody else, and that's why it's a big part of the health reform proposals, that people should have somebody coordinating their medical care, sort of like a quarterback or whatever you want to call it, so that people can get good access to their physician, a family physician, in the next day or two if they're sick or if they have some concerns, and hopefully not have to go to urgent cares or emergency rooms to get medical care. In those situations, you're seeing people who don't know you, as opposed to the family doctor's office where people do know you. They've got all your medical records. They know what medications you're on, and hopefully can give you good personal care.
And they could prevent maybe drug interactions before they happen because
absolutely.
They know you.
And that's a big piece. A lot of people are on multiple medications, and it's very tough to keep track of all those medications.
Could you see, if we go this direction, it transforming healthcare in general?
Absolutely, absolutely. It's going to make it, I think, a more friendly environment for patients if they know that they can pick up the phone and call their family physician and know that they'll get attention. They'll be talking to somebody that they know in their physician's office, and hopefully better quality medical care.
What is it going to take to get there? What do we need to do to jump the hurdle?
I don't think that we have to necessarily do anything special. I think we need to change people's mindset a little bit. People are used to going all kinds of different places for medical care and not seeing the need to have someone coordinate this whole thing.
And really, this is something old that we're trying to make new again, in a way.
It's sort of like the way medicine was practiced maybe 20 or 30 years ago, when everybody had a family doctor, and the system has become fragmented, and at the same time, not only has the quality of medical care declined, the cost has gone way up.
And I'm sure you're keeping a close eye on legislation right now.
It's kind of tough because there are a lot of proposals out there, but like I say, this is part of all of those proposals.
Do you think it's feasible? Do you think we can reach this?
Yep, I do.
Yeah.
Yep. I mean, we've been in practice for about 6.5 years now, and we've tried to do this from day one. We try to get people in when they're sick, especially kids. We get them in the same day. Those kinds of things to make the access easy, quick for people, yeah, I think it's very doable. A lot of family doctors' offices around the country are already attempting to do a good job of this. A part of this also is going to involve electronic medical records to make the access to data much more streamlined. But even with paper charts, we can still have easy access to people's records.
And where would you recommend people go just to find out a little bit more? Is there some sites on the internet?
Probably one of the best places to go is Wikipedia. If you look up patient-centered medical home in Wikipedia, there's several pages. There are links to very good websites. It's a very good place to go.
Thank you, Dr. Reed. Very interesting this midday. Well, again, our Healthy Living segment airs right here on Wednesdays. For more information on healthy living, be sure to check out our website at WTHI-TV.com. And just a quick reminder, we'll conduct another Healthy Living live webcast tomorrow on WTHI-TV.com. Dr. Whitman will be our guest. He'll join us from the Back and Neck Pain Center. The webcast starts at 1 o'clock. For complete details and to submit a question, simply go to our website. That's WTHI-TV.com.